Welcome back. My next guest on Your Baby's Future and the Miracle of Cord Blood is Dr. Weiss Young. He is a professor of cellular biology and neuroscience and founding director of the W.M. Keck Center for Collaborative Neuroscience at Rutgers University and global medical director for StemSight. Dr. Young, welcome to the show.
Thank you so much. I'm honored to be here.
It's very nice having you here. Besides good prenatal care, what do you consider to be important in planning for the health of babies born today?
Babies have to be taken care of, and we're now entering a very, very important time when we can take care of babies both before and after their birth in ways that we've never been able to do before. And it's a wonderful opportunity for doctors today.
Absolutely. Now, what's the benefit of storing these cord blood cells?
Well, the blood can be kept for 20, 30, 40 years, and they match the baby perfectly. They are the baby's own blood, and they're filled with stem cells, and these stem cells can repair the heart, the brain, the spinal cord, and many other parts of the body.
Why is it important that it's my baby's cord blood? Aren't there blood banks with the same blood type?
Absolutely. You can indeed, if you didn't collect your baby's cord blood, use blood from public banks to treat your baby. But the match is not perfect. Your baby's blood is your baby's blood. It will be a perfect match, and it comes from the youngest time of his or her life. And so if you had a choice, which one would you use? You would use your baby's own blood to treat it.
Dr. Young, how do stem cells work?
Stem cells are marvelous cells. We didn't know that they exist. Prior to 1997, we didn't really think of stem cells as being present in our bodies. But they go and they repair everything in the body. So you can imagine there are 400 different cells in our body. When you want to repair something, you don't want to send 50 different kinds of cells, repair the blood vessels, repair the muscles, repair the skin, repair this. You send one cell. They go there and they make the cells that's needed, and they repair that part of the tissue that needs it. And so stem cells are very, very efficient ways of cleaning up and producing the cells that's necessary, just necessary to fix your tissues. And we didn't realize this for a long time, that this is what happens in our body. Now, one of the most interesting things is that as we get older, our stem cells are not as good. It's one of the reasons why we age. We don't replace the cells that are being lost in our body. And eventually, of course, we die because we don't have the stem cells to make us youthful again.
I know there's ongoing research using stem cells, but what's around the corner?
Well, right now we're at the very, very beginning. Many doctors even are skeptical that stem cells can be used to treat many different kinds of diseases. The more we look, the more they seem to be able to do. Now, we have to do the clinical trials now to find out what they're best for, how to apply them, when you apply them, what the dose is, and we need to know whether they work or not. Stem cells don't know everything, they don't do everything. It's not like you sprinkle some stem cells on and you're cured. It doesn't happen that way. They're a tool, they're a treatment. Just like all treatments, we have to understand them, and we have to study them, and we have to do clinical trials.
Well, it's very exciting. This is a new frontier, and it holds much promise for newborns today. Thank you for being here. If you at home are interested in more information about this once-in-a-lifetime gift for your baby, or if you're a grandparent who wants to make a contribution to the ongoing health of your grandchild, visit the website or call the number on your screen now. You can get a free Cord Blood 411 booklet. It lets you know what to expect and prepare for in the last 60 days of pregnancy. Dr. Young, the storage of the stem cells is for a lifetime. Now, where do you suggest our viewers get a collection kit, and what should they look for in a company?
They should find a company that's experienced. They should find a company that has a track record of using the cells to treat people. There are very, very few companies that do that. And I believe that StemSight is the company to do so.
Do all collections get the same results?
Cord blood collection is tricky. You have to do it right. You have to follow the standard operating procedures. You have to follow all the rules. If you don't do it right, the cells die. Now, a company that is always using their cells to treat patients, their stem cells are being tested every day. You know that they are doing it right because they're working. If you collect a lot of cord blood and you don't use them, then you don't get tested. How do you know that they're any good?
Dr. Young, we understand you're very involved in regenerative medicine, specifically the treatment of spinal cord injuries. Would you care to expand on the exciting possibilities regarding this research?
As you know, spinal cord injury is a terrible condition. We have no treatment for it right now. And we're hoping that umbilical cord blood cells transplanted into the spinal cord of people who have long-time spinal cord injury or chronic spinal cord injury will restore function. This is the hope. This is the goal of all neuroscientists. And so we have already started transplanting umbilical cord blood cells into patients with spinal cord injury in China, and soon next year in the United States, in Europe, and in India. We believe that these cells will regenerate the spinal cord and restore function. It's a very, very exciting time.
It seems like the advancement in science and medicine are increasing at a very rapid pace. Would you share your vision of the future for the uses of stem cells?
You know, for over 100, I should say, for over 1,000 years now, medicine has always taken things out of the body to treat them. You know, for example, we would take out tumors, we would take out whatever we think is causing disease or problems in the brain and the body and the spinal cord. But now we're talking for the first time of putting stem cells in that will go in and repair parts of the body. This is an incredible advance. This is a brand new world for us. And of course, this is the reason why stem cells was voted in the year 2000 to be the most significant advance in medicine over the last century. We want to apply stem cells to treat these conditions that have never been treated before effectively. And umbilical cord blood cells are these cells that can treat hematopoietic diseases. These are blood problems, leukemias, thalassemias. But we now want to take these and treat the heart. We want to treat the brain. We want to treat the spinal cord. And quite recently, there's some very, very intriguing evidence suggesting that umbilical cord blood can even be used to treat diseases like AIDS, HIV/AIDS. There was one man recently cured of AIDS with bone marrow stem cells, but this is very rare. It's very difficult to find a perfect match of a bone marrow that has a specific genetic mutation that would make the blood resistant to AIDS. But StemCyte now has found 36 such units amongst its umbilical cord blood cell collection that, if transplanted into the right person with AIDS, will cure AIDS, we believe. And so it's one of these really exciting times when a lot of diseases that we haven't been able to treat can now be curable with stem cells from umbilical cord blood.
Dr. Young, thank you for sharing this vital information with us. We're all hoping your stem cell research brings additional treatment and restorative health to future generations.